My name is Matthew Randall. I'm a physical therapist and I practice for the Jackson Clinics. Low back pain is very common. Up to 90% of Americans will experience low back pain at some point in their lives. Oftentimes the pain will go away, but when it does not, the patient should seek physical therapy intervention. Sometimes the pain is very severe or it keeps reoccurring. This is important for the person to find out what is causing their pain. There can be many causes of low back pain. Some are caused by an overuse injury, such as standing or bending, lifting too much. Some are caused by an acute injury like a strain. The patient can expect to be evaluated thoroughly from head to toe. We look at the entire body or the whole picture of what's going on and what is contributing to the back pain. We don't want to just treat the pain, but we want to find out what is causing that. The treatment plans from physical therapists are very specific to the type of the patient. They can use manual therapy techniques such as joint manipulation or soft tissue mobilization to help restore mobility in a very stiff back. They do a lot of education for the patient to prevent future back injury and teach them how to use their legs and their back appropriately, such as rising from a chair, getting out of bed, bending and lifting correctly. One of the things I want to talk about is our posture. Can you sit up for me as straight as you can? Good. So using the muscles in the low back to support ourselves. If we're slouching down for long periods of time, our spine is more flexed and the structures on the back of the spine will get more strain and stress sitting down here for long periods of time. So it's important to come up and take breaks to unload that structure on the back, just like you're sitting here. So the exercise we're going to do is not appropriate for everyone, but in your case, to be very stiff in your low back, we're going to use this to help improve the mobility of your low back. What you're going to do is round out your back like a mountain, rounding this part and coming up, letting the head come down. Great. And then we're going to reverse that, let the head come up, and sink this down like a valley. Excellent. Go ahead and repeat that. Head coming down, rounding out the back very high. You may feel a slight stretch along the back. Great. And let's reverse that one more time. Come on down, head coming up. Back pain can't always be prevented, but there are things that we can do to take care of our back, such as sitting up straight when we're sitting down for a long period of time, making sure we're healthy and fit, our core is strong, and making sure that we bend, lift, and twist appropriately and not overuse those back muscles.